Well, we begin tonight with new information on the Delta variant sweeping the country. This has definitely got a lot of people talking. Cases are on the rise in 28 states, and a third of the new cases are in 5 hotspots with low vaccination rates.
And today, state health officials gave us a clearer picture of where the Delta variant stands here in Ohio. Our senior health correspondent, Monica Robbins, joins us now. Monica, should we be concerned?
Well, yeah, I think we should, especially if you're not vaccinated. You need to be concerned. You know, we are very, very lucky here in Northeast Ohio because most of our counties are at or over the state average of 45% fully vaccinated. Cuyahoga County, for example, is at nearly 54% of those who have at least had one dose. Lake County, 55% at least people who have had one dose. But today's discussion was basically a warning to those who are not vaccinated or those who can't be, such as children. So we all know masking, social distancing, and avoiding crowds should continue because the Delta variant is here. It's spreading fast and has the ability to make people more sick.
The difference for the Delta variant is it takes less of the virus going from my mouth or my nose to yours to potentially infect you.
Estimates are that it's about 50% more contagious than Alpha, or the B.1.1.7 so-called UK variant, which itself was 50% more contagious than the variant which caused our winter surge.
So what's also encouraging here in Ohio is that we're not seeing a surge in hospitalizations yet. However, there has been a slight increase in just the last couple of days of patients needing ventilators. But again, that number is still in the low 60s. Now, the big concern, super spreader events in highly unvaccinated areas that are going to cause a jump in cluster cases, which is why health officials are hoping these preventative measures that we know work will be taken seriously.
Well, and of course, the people who have the vaccine are sitting back and going, I got nothing to worry about. I got the vaccine. Keep in mind, though, there are so-called breakthrough infections.
Yeah, that's important to remember. You know, we've said from the beginning that these vaccines are 95% effective. Johnson & Johnson, less effective than that. About 45 states keep data on breakthrough infections. Ohio is one of them. And between March 2nd and the end of June, there were 19 deaths of fully vaccinated people, according to Dr. Vanderhoff. And he says the median age was 81, and many of those people had underlying conditions too. Now, these vaccines are effective. We know that. But again, they're not 100%. Nationally, breakthrough deaths are happening in about 1% of the vaccinated people. Also, a lot of people have conditions which may make the vaccine even less effective, such as cancer treatments. So there are a lot of variables, but it is very clear the vaccines do work in the majority. And I've been checking around, and our hospitals are seeing 99% of the people in hospitals are unvaccinated.
And I believe we can say 100% of the recent deaths are in people that are not vaccinated. In case you're wondering, is it still killing people in Ohio? I looked today. 100 people have died of COVID since July 1st. That's just 2 weeks. All of them unvaxxed.
Yeah, I think the data is there, but again, you know, for kids, little kids, you know, we have people here who are, you know, moms who are still wearing their masks because they're afraid they don't want to take anything home to the kids, and that's why we need to remember those prevention methods that we've been using, they did work, and if you're not vaccinated or you can't be, I think it's really important that you remember those things do work, and you might want to practice them again.
Well, I'll hang my head in shame. I have been lax on making Violet wear her mask when we're out and about, and I think that's going to have to change.
Yeah, it may, and especially in crowded areas.
Yeah,
you got
to 6, so she can't get that vaccine.
Yeah.
All right.
Thank you.
Don't go far. We'll see you in just a little bit for Wellness Wednesday.
You got us.
Okay, Monica, thanks.